little over 2 years ago, I was coaching my daughter's basketball team. Didn't like the way the drill that they were doing, so I kind of jumped in the middle of it and showed them how to do it. I'm not as young as I used to be. So the next morning I get up and I've got this severe back pain. And I thought, well, I just pulled and strained something, it wasn't any big deal. A month later, I'm still in pain, thinking this is just really kind of strange. And we went and had an MRI done, and it didn't show anything that they could see.
Some very good doctors in the Metroplex had been taking care of him for a related problem of his hip. As I started examining him and talking with him, I realized that there was something going on in his hip joint itself.
He pulls the MRI up on the computer and says, yeah, we've got some kind of a tumor that had caused some weakening in the bones. There was a fracture one, there was a tumor, and it was an ugly mess.
It's one of those hip cancers that is eating away at his pelvis and eating away at his hip, and just weight bearing alone, walking, could cause a hip fracture, a pelvic fracture that could put him into extreme pain and extreme need for surgical intervention. Here's this guy who walked in on his own and who thought, well, I'm just getting another shot like I've always gotten, and now I'm telling him, you can't put any weight on this hip. You've got to go on crutches until further notice. You really need to go to MD Anderson. This is an MD Anderson type problem, and he did, and he went down there and he had surgery.
I went and had a hemipelvectomy, and they remove half of your pelvis out with an allograft. So they put somebody else's pelvis in me, gave me a hip replacement at the same time, 16 hours worth of surgery, 3 hours of plastic surgery. It was a pretty major ordeal.
He had a line in for an IV so he could get his chemotherapy, lost all of his hair, lost a lot of his weight, and just went through this journey that he didn't know if he was going to survive. I think he's the only 2-year survivor of this type of cancer without a recurrence that's known.
In combination of what the doctors do, hats off to Dr. Stevens, taking the first step to find my problem, get it diagnosed correctly, and then find the proper treatment.
Now he's back, family man, coach, dad, businessman, and back to himself again.